Today we have a nice meeting about whether single use or reuse of the laparoscopic instruments. We have many of the experts in this scientific meeting. We will share our experience. We will share the international guidelines about the reuse or the single use of the instruments, whether this can be done or not. I want to welcome first my colleague, my professors, and my mentors. We have Prof. Dr. Fahim Bassiouni, the Professor of Surgery, Cairo University, and the head of the laparoscopic Society of Laparoscopic Egyptian Society. Also, we have Prof. Dr. Ashraf Bakr, Professor of General Surgery, Cairo University, one of the most scientific lecturer in our university. Also, we have Prof. Dr. Abdurrahman Salim, consultant of bariatric surgery in KSA. And me, I am Dr. Tamer Nabil, Professor of General and Laparoscopic Surgery, Consultant Bariatric Surgery, Bani Suef University. I want to start with sharing with us Dr. Muhammad Youssef, the host of these scientific meetings and Professor of General Surgery, Cairo University, and Consultant of Bariatric Surgery. I want to start by Dr. Ashraf Bakr. Dr. Ashraf, if I want you to speak about the international guidelines about reuse or single use of laparoscopic instruments, what's your opinion?
First, I would like to thank the organizing committee for inviting me for this popular issue. And I want to discuss with you or to clarify with you what are the issues related to this topic. So we have certain issues related to this topic. First, the feasibility. Second, the safety. Third, the processing. Fourth is the cost effectiveness, and finally the problems with this issue. So I think there are certain things that we have to discuss during this meeting about this process. And I think these issues varies from one country to another. Would you agree about that?
Yes.
Me
yes.
also.
So the feasibility, apparently, as we discussed before the start of the meeting, it's feasible. It's done in many areas, many countries, rich and poor. But what is the motive? The most important motive, to my mind, is cost effectiveness. Is it cost effective or not? But the other issues are not at the same priority as cost effectiveness. First issue is patient safety. I don't think there are recognized international guidelines in this issue. There are guidelines that are local, depends on the country and on the organization, but there are no widespread or recognized or agreed upon international guidelines. But there are certain factors that has to be taken into consideration. Let us just discuss the issue of cost effectiveness. Cost effectiveness, because it is the most important, so to speak, motive for others. There are literature reviews a lot about this. I will revise with you only one of them. Over a 4-year period in one country, in one hospital, they used to reprocess laparoscopic instruments. They said that purchasing the 10 commonly used reused disposable laparoscopic instruments costed $180,000. Reprocessing over 4 years $35,000. That's about 200,000, 15, something like that. Each instrument was reused 1.7 to 68 times each. Can you believe that 68 times each? While the cost for not using this will be $500,000, $27,000. That's about half the cost. And this is because the reprocessing was done in a regular important fashion. And the regular important fashion, as regard the guidelines asked by Dr. Tamer, we have 4 things to be done. We have to do cleaning and disinfection. You have to do lubrication. You have to do inspection and then sterilization. So we have 4 steps according to the guidelines to have a safe reprocessed single-use instrument. First one is cleaning and disinfection. One of the important items neglected is that cleaning is important to be done within the next 30 minutes after the end of the procedure. Otherwise, blood will be clotted and it will never be possible to disinfect. The second thing, cleaning is not only by water. Cleaning should use advanced instruments like ultrasonic cleaning by cavitation, which is the most effective, but it is costly as well. So if we follow the 4 processes, cleaning and disinfection, lubrication, tell me who is doing lubrication while reprocessing in your organization? No one is keen about this. An inspection for the performance, and finally the sterilization. So if you do the 4 things properly, you may use single-use instruments more than 1 time. But the most important item, which is the first item, is cleaning and disinfection. If you cannot clean the instrument properly, you will never be able to use it. And the standard is, if the instrument has a lumen that you cannot clean properly, then do not reuse this instrument. Thank you very much.
Thanks, Dr. Ashraf. I want to ask Dr. Fahim Basyuni, do reusing the disposable instruments affect the efficacy of the instruments? One of the fears that multiple reuse will end with technical errors in reusing the same instruments. Did you face the same problem, or this is a big issue or not?
Do you see me and hear me?
Yes.
I see. Well, actually, the situation is different between the countries, as Dr. Ashraf just said. Probably some of the countries, they do not allow reuse of these disposable instruments. But anyway, in poor countries like ours, like in India, like some African countries, it's quite costly not to reuse the disposable instruments. Our concern is, as Dr. Ashraf said, of 2 things. Are they safe, or are they effective? Regarding the safety, proper sterilization, starting by cleaning, as Dr. Ashraf just said, secures the safety of the instruments. The other issue, which is quite important, is the efficacy. There is no doubt that actually the ways of sterilization were decided that no one is feeling secure about it right now. Ethylene oxides that no one is using now. The most popular way of sterilization of disposable instruments plasma. Plasma has, of course, is very effective in securing the sterilization of the instruments, yet they change the substance of the plastic substance of the instruments so that one cannot reuse the instruments so many times. and we all saw that the trokers, the pores are very sticky, are very tight around the instruments when they are reused after plasma. We all observed that the staplers are not effective, or sometimes they get locked when they are used more than one time. This actually depends upon the frequency of how many times you are using, because there is no guidelines about how many times you can use. Dr. Abdurrahman, before we start, said they just use trokers once, which we don't do. We reuse them. And he said that the echelon staplers are being used there twice. And in fact, in our country, we use them more than twice. So it's the way plasma changes the efficacy of the instruments, including the ligature, including the staplers, and changing the substance of the trokers. So it's the way how many times you use these instruments. So if we use them for a limited, I don't know how many times, but if we use them for a limited times, then it's effective. Its efficacy is good. But if we just let them use them until they get blocked, then you will find that the stapler is locked inside the body, and it's a big problem. And we all faced this issue. So it's about that.
Thanks, Dr. Fahim. Then I want to share part of the speech of Dr. Fahim with Dr. Abdurrahman. Dr. Fahim told us about the difference between the instruments, the trokers, and the staplers. So are the guidelines the same for the staplers, instruments, and energy source handles, Dr. Abdurrahman? Even between the different brands, do you feel safe with re-sterilization of one brand like Echelon Flex? You know that the knife is within the stapler, versus the Medtronic, the reload without the knife, the reload contains the knife. What about the guidelines about that?
Bismillah ar-Rahman ar-Rahim. Thank you for the invitation. In Saudi Arabia, actually, if you are talking about the governmental and the official institutes, we are not allowed to reuse instruments, and that's by heart. If you go to the big institutes like King Faisal, military or security force, or universities, we don't reuse instruments. Now, if you're talking in private, it depends on the institute itself. In my hospital, actually, which is a private sector, I used to work in King Faisal, and that by heart, there is nothing called reuse. It's everything is single use, except definitely the instruments which are autoclavable. And for instance, there are instruments which are single use, like scissors or Babcocks, or that like the Medtronic single-use instruments. That's what I use it for once. While there are reusable instruments that goes into the autoclave or in plasma, and these we reuse them. That's the case in all the governmental and official hospitals in Kingdom. Now, if you are talking about private, the private is different, and it differs as well from hospital to hospital. In the hospital where I'm working now, we are using some of the instruments, specifically like ligature. We are cleaning it and then put it in the plasma for sterilization, and we reuse it. And we reuse it until it dies, like used more than 4 or 5 times. Now, if you talk about the echelon flex, we are using it maximum twice, and definitely in the second use, you have to be careful when you are firing it because the knife is not as good as the first time. For Medtronic, the Signia, all are disposable. It's just one use, either staples or the plastic cover, all are just single use. There are things which we recycling for many times. There are things which we're recycling for 2 times, and are things that you cannot because it's just single fire. That's the case in my private hospital, but there are other private hospitals that are insisting on only single use. That's the situation at the kingdom here.
Actually, as all the panelists agree that the international guidelines with the single use with difference between countries. But I want to ask everyone from the panelists about the personal experience. I will start with Dr. Muhammad Yusuf. What's your personal experience about the reuse of the instruments in the laparoscopic surgery? Dr. Muhammad, do you hear me?
No, he's not with us.
Okay.
He was with us, and then he went away.
Yes. Let us to start again with you, Dr. Fahim. What about your personal experience? Whether you use single-use instruments or reuse of the instruments again?
I reuse disposable instruments. I do reuse them. And what I say to my assistants is that if you use an instrument, you have to mark on the instrument how many times did we use them. Because after sometimes this instrument, if it is a trocar, it will leak all the time and it will be a trouble the whole work. If it is a ligature, it will not be effective. It will show as if it is working, but it will not work properly. And if it is a stapler, whether, of course, the problem with the stapler is more with Echelon, because the job of the Echelon machine is more than, because the knife is inside the, plus that it is more silly in the use. The grip is better, but it is more difficult to use regarding the reuse, I mean, more than that of Medtronic. Anyway, one has to mark how many times, and to my mind, that if you limit the times of reuse, then probably you would not have a problem. To limit doesn't mean that 10, 12, 20 times. To limit means 4 times, depending upon the previous surgery, of course, and sometimes the previous surgery will necessitate that you will just dispose this instrument, probably. But limiting the times will not let you fall into troubles. But if you just leave them until they don't work anymore, then probably you will have problems. Of course, with the ports, the issue is not that it's a trouble during, especially if the patient is fat and you need a space. If the trocar is all the time leaking, then you will have a problem. You have difficulty during the surgery. It's for energy instruments. Probably in sometimes they don't work properly. You see them as if they are working, but they are not working properly. And the same for the staplers. Sometimes they lock inside, and it's a big problem. And unless you have the experience how to manage, then you will have a big trouble. So in my experience, you just limit the times of the use. This is number one. Number two, there is nothing called sterilization except for the plasma. This plasma changes the nature of plastics. This is true. So you cannot re-sterilize more than few times, not too much.
Okay, Dr. Fahim, I will forward the same question to Dr. Ashraf. What about your personal experience with the reuse of the instruments? Dr. Fahim, give us 2-3 tips about the safety before reuse of the instruments. What about your experience? I think you are still muted, Dr. Ashraf.
Unmute. Okay, you can hear me now.
Yes, yes.
Okay. I worked in a tertiary referral hospital for a long time, and this hospital has two eras, so to speak. One era is before GCI accreditation, and the other era is after GCI accreditation, Joint Commission International, as you all know. Before the GCI accreditation, as Dr. Fahim said, we used to use the instruments for as long as it works. But after the GCI accreditation, they don't recommend using the single-use instruments more than one time, but they have some sort of regulations. One of these regulations is if the instrument cannot be visibly clean, you cannot re-sterilize. This is very important. And so if you are using, for example, a port with lots of moving parts and you have to dismantle to clean and you cannot visibly clean it, you cannot re-sterilize. If the instrument has a lumen, like the energy resources, they have lines and wires in the lumen, and these cannot be visibly clean, so they cannot re-sterilize these things. But if the instrument is, for example, like a grasper or a scissor or a dissector that has no lumen and you can visibly clean it, you can re-sterilize it. But again, as Dr. Fahim said, for a limited number, you cannot re-sterilize forever because the performance of the instrument changes. In this hospital, after GCI accreditation, the process is the 4 things I mentioned before: the cleaning and disinfection, lubrication, inspection, and then if the inspection proves that the instrument is clean and functioning, I mean, you can open and close, etc., you can re-sterilize. The maximum number used was 3 times. You can use the instruments for 3 times. Each time they make a mark on the instrument with a permanent marker, so they know this is number 1, number 2, number 3, and then they have to throw it away or use it for training or whatever, but you cannot use it for patients, even if it looks good and functions well. And this is important because if you are greedy and you want to use it, it's okay. You can use it again. No, so it's 3 times the maximum used for this. And this was the process after GCI accreditation. One of the things that are important, for example, is that even when using the plasma, there are rules. One of the rules is that you have to re-sterilize while the jaws are open. You cannot re-sterilize with the jaws closed, because if it's closed, the plasma may not reach one of the jaws. So the jaws has to be. I mean, the attention to these minor details means a lot. And thank God, with using reused instruments, we never have a problem either with the infection or with the performance of the instruments. Of course, the more sophisticated instruments like staplers, like energy devices, it's very difficult to clean, and as long as it's very difficult to clean, it's very difficult to accept re-sterilization. One final issue, so as not to be lengthy in my talk, you have to balance between reprocessing single-use instruments versus using reusable instruments. Now we have a lot of companies producing very good quality reusable instruments, and even with the modular system, you have the handle separate from the shaft, separate from the blade itself, and this costs a lot more than the disposable at the very beginning. It's a good investment, but we can be re-sterilized even using autoclaving, which is much better than plasma, and and it can be used for as long as it works, not as for 3 times only. So we have to balance this for using reusable instruments versus reprocessing single-use instruments. And thank you very much for
that. Dr. Abdurrahman, you work in Saudi Arabia, and all of us know that the regulations in Saudi Arabia are different from that in Egypt. They are so tight about the reuse of the instruments, as you mentioned before. But really, if you can add some tips to what Dr. Fahim and Dr. Ashraf said about the reuse of the instruments, and whether you discuss with the patient these details before the procedure or not. Do you mention to the patient that you will reuse the instruments, or you will use a single-use instruments? Is this an open discussion with the patients or not? Unmute yourself, Dr. Abdurrahman.
Thank you again. Just before I answer the questions, I had misfire from reused instruments actually, and I had one bad experience that the misfire was at the one before last fire, and that obviously when we had misfire and like that, it stapled. Didn't staple actually, it cut without stapling, and that was one of patients. We ended by stitching that hole in 2 layers, and we ended actually by stricture in that area. Stricture was not that bad, but the patient gets on and off obstruction. He eats solid food. That area gets obstructed. The good part of that quote-unquote stricture, that the patient, he was like 170 kg, now he's 70 kg. That's the only good part. He obviously had heartburn. It seems like that tight area, the saliva and maybe the acid regurgitated into the esophagus, and he has heartburn. We dilated it more than one time with no much of success, and we offered him actually to go for bypass, but he said he's happy with what he has, what he achieved. There are a drawback actually of using these instruments more than one time, and that's why I said in the previously, when you fire it, you have to be very careful that you go slow and don't go fast with the instruments. And if you start to feel like that misfire is going on, just stop, open it, and switch to a proper instrument. Now, obviously, I didn't face a question from patients that are you reusing the instruments or not, and I don't discuss it because I consider basically when we reuse it, it's trial and it's not going to harm the patient. It's true that we have accidents of misfire, but we have accidents of misfire even with the new instruments. I don't know if really, because it's reusable, it was the problem. The misfire came, but the cause of the misfire is the reusing the instruments. We had misfire with a new instruments. I cannot comment on that, but we don't discuss, and I never did hit my mind that I have to tell the patient that we are going to reuse the instruments. And frankly speaking, it's maybe the reusing it will do it in once in a while, but that's not the routine. The routine is basically we use a new instance. I didn't discuss with the patient. I don't discuss with the patient, and I didn't face a questions from the patients if we are gonna use a new or reusable instance. The usual question is, are you using the new machines? My response to the patient, and we have the Signia, we have the manual, we have the powered issue, we have the issue, we have the whole shebang. And how I differentiate between this and that, it's just, if there is no rules in which instrument I'm going to use for such case. In general, when I'm doing mails, big mails, I usually use manual issue. I feel it's the grasping the issue is far a bit better than the Signia or the Medtronic tools. Powered, it's more expensive, and I don't see an added advantage of powered echelon versus the regular echelon. That's I hope I answered your questions, Dr. Tamer.
Thanks, Dr. Abdurrahman. Dr. Fahim, as Dr. Abdurrahman mentions that the regulations in Saudi Arabia is very tight, and there is no open discussion with the patient about the instruments. The culture in Egypt is different. 1 year ago, I seen the patients came to our clinics asking whether you are using international brand or Chinese brands, you are using single use or reused instruments. It appears that the doctors have benefits from the reusing of the instruments. Actually, why we are reusing the instruments? Unmute yourself, Dr. Fahim.
Yes, a very good question. The point is, what is the difference between reusable instruments and disposable instruments? I'm not talking about, there are some instruments that the only copy is the disposable, like staplers, for example, and some of the energy, because some of the energy others instruments can be reusable, but most of them, they are disposable. This is one issue. The other issue is, if you have a trocar, a disposable trocar and a reusable trocar, the disposable trocar is much more easy to manipulate, to use through. Also the instruments, like the endoclinch, if you remember the endoclinch, the manipulation of the endoclinch, the disposable, is easier than the endoclinch that is reusable. This is one important issue. But in general, the guidelines should be that you minimize, as Dr. Ashraf just said, you minimize your use of the disposable as much as you can. And if you are to use them, then you manage the way, the proper sterilization, proper cleaning, proper sterilization, and limited use. Talking about Egypt, and in our practice, yes, some patients, not all of them, they come and say, are you using the instruments once or many times? And the answer will be, we are reusing them just to minimize the cost on the patient or to increase our profit. It depends upon the surgeon. Some surgeons, they use Chinese brands which are cheap, and I'm not saying that they are unsafe. I don't know if they are safe or not, but our idea about the Chinese brands and the new brands is that, and the new operations is that they are unsafe until proved otherwise. we are working in a very critical field, and our patient is sensitive and is fragile, and he needs to know or to be assured. So sometimes we say that we use the instruments several times, but for limited times and for a safe, in a safe way. But if you like to use the instruments once, then you may pay more. One other issue is that if the patient is a redo patient, or if he is a difficult patient like super obese and heavy men, then our advice is to use the new instruments at least. I mean, you may reuse them again, but you use it in redo patient and in a difficult patient. I mean, don't leave your work to circumstances. The instrument will be blocked or not, it will work or not, it will fail or not. This patient should be afforded the best chance, and the best chance should be that the instrument should be used for the first time. But otherwise, other, like Dr. Abdurrahman said, for trokers, for example, the troker of the retractor doesn't need to be disposable. The troker for the camera doesn't need to be disposable. The 5mm trokers also, they don't need to be disposable. So you can use this reusable. But for your right and left hand working ports, I think they better will be disposable, especially they will allow the passage, the ease of the passage of staplers, for example.
Do you agree that if you will use Chinese chokers, this will lower the cost without effect about the efficacy you need chokers?
The trokers are not a big deal. The trokers, because they are not dangerous. If they don't work, you just throw them away and get another one. This is not a big issue. The trokers can be used Chinese or Indian or Egyptian or whatever. But this is not applicable for the stapler. You have to be sure that, because this will remain inside the body. And this, if it doesn't work, the patient may die. You may lose a patient. So I am not saying the Chinese manufacturer is bad, because Johnson & Johnson and Medtronic, they are using their factories inside China. But I'm talking about Chinese products or Chinese copies of the products. Up till now, I'm not 100% sure, and will need some time until they get the confidence of the surgeons. And when they get the confidence of the surgeons, then they are as if they are Medtronic or J&J. But I cannot, to my patients, I cannot at the moment offer a Chinese product. And something more, that it is linked in the mind of patients that Chinese something means the Fanus Ramadan and the toys of the children. They work once and then they are no more working. So it's not accepted in our practice. Yeah.
Thanks, Dr. Fahim. Now, Dr. Muhammad Yusuf is sharing with us. I want to transfer the speech for you, Dr. Muhammad. What about your experience? Are you with or against?
Yes, thank you, and I'm sorry for being late. I don't know what was what you call mentioned by my elite colleagues, but
this is a good point.
No, I think you should cover already the economic factor, and that the economic factors should not violate guidelines of safety and infection and good performance of instruments. As you know, Tamer, I love to work with either autoclaved instruments or gas sterilized. In the past, most of us used to use Sidex, but we have seen a few cases in what you call our practice, which was since more than 25 years. We have seen some cases of serositis, even pleural effusion, some peritonism. So I think we should not use the Sidex, except if we are sure that we will be able to, number one, clean instruments very well before using Sidex. And after using Sidex, we should rinse all the instruments by a good amount of sterilized water. Regarding using the disposables, I think, for example, the harmonic or Medisure or instruments which I mean, there is no grooves or pits or holes which will be difficult to be cleaned. I think it's allowable to reuse it. But some staplers, for example, it's very difficult to clean these staplers from tissues and debris. So I think, although it's difficult to use it once, but I think this is the best. Wallahu a'lam.
No difference. Dr. Ashraf, we spoke about the mechanical failure, and Dr. Abdurrahman mentioned one case scenario, and I think all of us have the same issues like Dr. Abdurrahman with the reuse of the staplers or mainly the staplers. But I want to ask you, is there anything to be done to minimize the rate of the infection of the blood-borne infection like hepatitis C or hepatitis B or HIV, especially as you know that the incidence of hepatitis C in Egypt is very high?
It was very high, not any high after this treatment campaign. Okay, as Dr. Fahim said, high-tech instruments like energy devices and staplers are difficult to have failure in these. If you have failure in a trocar or in a grasper, no problem. But failure in high-tech instruments like the energy devices or the staplers is very serious. And the second issue you mentioned before is discussing with the patient whether to use or not to use reused instruments. I think the big problem, especially in Egypt, is the lack of proper insurance. Why people using reprocessed instruments? Because the cost is high to patients. And why the cost high to patients? Because they have no proper insurance that can cover these procedures. So if we have proper insurance, this problem will gradually diminish. As having said that, I think for high-tech instruments, we should not use reused instruments or reprocessed instruments, so to speak. So for the stapler, for example, I think using a new one at any time is important. There are types, as you said, that with the knife in the stapler. I think this is much more safer. If you want to use many times, you can use this instead of the one with the, I don't want to use to trade names. So if the knife is in the cartridge itself, this is much better than if we have the knife in the instrument that you are reprocessing every time. I think it is safer for the patient as well.
Dr. Tamer, allow me, I have a question to all the speakers. Do you think that we are following these strict guidelines in the governmental hospital we are working in? I mean, is this apply for both private hospitals and governmental hospitals, or we are sometimes obliged to work under some infection control constraints in governmental hospitals?
If I may ask, I think this is very individualized. I mean, some private hospitals are very strict, even more than governmental hospitals. And even in governmental hospitals, some hospitals are very strict while others are not strict. It depends on the system of the hospital and the management. And if you have good management and good system, even governmental or private hospitals, you can be very safe. But it is not universal. It is totally individualized for the hospital, to my mind, in Egypt in particular.
What's your opinion, Dr. Fahim?
Yeah, what Dr. Ashraf said is absolutely right. The private hospitals and the governmental hospitals, each hospital has or doesn't have guidelines. They have their own guidelines in each hospital. We have in Egypt some private hospitals which will never allow the reuse of disposables, and they have a good infection control committee, while infection control committee that is supposed to work in governmental hospitals, sometimes it doesn't work. So it is individualized, truly.
Yeah, but what about the surgeon himself? I mean,
this is another individualization. This is another thing. But most of the private practice, I'm not saying most, say, 99% of the private practice allow the reuse of disposables, and you know that.
Yes. Okay. My second question to Dr. Tamer and Dr. Abdurrahman: does this issue matter? The patients, what I mean, are your patients come to you asking, I want you to make my surgery with disposable instruments, and I will pay what you want? And what is the number of these patients who are asking this question? What's the percentage, I mean?
والحقيقة ما سمعتش، هو في طفل بيعيط فما ما سمعناش. انا مش عارف الطفل ده فين.
He is asking about the ratio.
ماكدونالدز، انا في ماكدونالدز فحقيقة مش قادر اعمل كنترول.
اوكي ايوه. اوكي.
If I'm answering, just unmute Dr. Muhammad. Tell Dr. Abdurrahman answer the question.
We answered the question before, Tamer, and as I said, in my practice, actually, I never faced that. Are we using new or reusable instruments? The most question or frequent question we ask it: are you using the top-notch instruments or like the electron? عارف الدباسة الإلكترونية والدباسة whatever يعني. Okay, that's the usual question. Are you using the top-notch instruments or not? And actually, we have all kind of stapler in our hospital. That usually I tell them that there are no difference between this and that. All are doing the same job. Just what are you seeing in media is just for propaganda and for every surgeon trying to advertise for himself. And regarding the Chinese instruments, actually, I used more than one time the Chinese instruments, and frankly, they are good. They are very good. and I'm envisioning the step line. For me, doesn't make difference if I'm using Chinese or European or German or American staples. Yani, frankly, all are giving me the same results. I'm securing my staple line by the envisionation. What fits, unfortunately, in our hostel, I requested for the Chinese instruments, and the administration refused to get them in. But I use it more than one time, and they are very good.
If the same question is directed to me, in my practice, some patients ask about whether I'm using single-use or reuse, and this is frankly speaking, I am telling them that I am using reusable instruments sterilized by plasma. If you wish your operation to be done with single-use, the cost will be more about 20,000. The price of the kit, and I think this is fair. You should be clear with the patient whether you are using reusable instruments or single-use instruments. So who is asking me to did the operation or to do the operation with single-use, the cost will increase, and he will take the instruments with him to be sure that this is for him. I want to speak also about this Chinese product, because recently I tried one brand of them. Chinese products, as we know, there is top notch, there is a second degree, third degree, fourth degree. To me, I used recently, I think 1 month ago, and I feel it's good, as I am doing the same like you. I am inverting the whole suture line. So it doesn't differ with me, and at the same time, I don't want to be single company that control the market. This is from my point of view.
Can I add something? Probably you said something that is good, but it's very serious. You said that there are two brands of the same brand. I mean,
yes.
Yes, they have the good one and the bad one. So imagine
yes.
that the bad one, somebody is using the bad one, and the patient will die.
Yes.
Because
yes,
this is very, very. What can I say? This is something.
Dr. Fahim, you know that this is the trust between the surgeon and the patient.
This is not ceramic. This is not balat. This is not clothes. This is something that patients depend upon to live. So how can I afford a good one and not a very good one? How? I know you are using the best. They brought here the best, but how China is allowing? This is not a car. This is something that patient can live with or can die with. So how comes they have two brands? One is good and one is bad of the same product. How comes?
It's not the good and the bad.
Allow me to comment that there are many Chinese companies who produce staplers. I think we should try to think how we may use Chinese products, but after being 100% sure that this is a safe stapler. I mean, we can, for example, see a lot of research papers. We can, for example, follow products which are rechecked by third party or allowed in the European market or US market. I mean, it is checked. But I agree with you, we should not take a Chinese stapler just with no third-party control, and we will try it in our patient.
Like
Absolutely.
FDA approved. FDA.
All the Chinese products are FDA approved. I don't think.
What is entered in Egypt, Dr. Muhammad, should be FDA approved and CA approved. Both.
May I ask a question, please?
Yeah.
If you, I don't know that anyone has any experience with this, but I'm just asking. Are you aware of any country or any individual or any organization reprocessing robotic instruments? You know, robotic instruments are far more expensive than regular laparoscopic instruments.
I don't know.
You don't know. Yeah.
What do you mean by reprocessing?
Robotic are used for specific times يا أشرف. يعني التول بتستخدم 4-5 مرات مثلا وبتترمي. كويس؟ فالروبوتيك مختلف، يعني هو ليه عدد معين من الاستعمالات وبعد كده الهاند بيس بتترمي.
What I know about the old robotic form that was in Qasr al-Aini, it was the Zeus form, the very primitive, the first, because you know that it was introduced in Qasr al-Aini before the Middle East. But what I know about the reuse of the robotic instrument, it was 40 times. The robotic instrument can be used up to 40 times in the time of Zeus. I don't know with the new brands, but it's not 3 or 4 times. No, so it is more expensive, but not that much.
Because it's important to know, because robotics are coming. Chinese now producing their own robotics, which are much more economic than the American or European brands as well. So I think in the next few years we'll face this issue as well.
I have a question to you, Dr. Ashraf. Probably you have an experience about the plasma sterilization. What about the penetration power? I mean, does it penetrate well like the autoclave, or it's just superficial like the say the Sidex? The Sidex does not penetrate enough. That's why you have to clean and remove the clots and that. What about the plasma? Does it penetrate or not?
Nothing is like an autoclave.
Yes.
And the plasma does not penetrate that deep. And that's why I said, for example, they have to keep the jaws open for the instrument during sterilization. If it is so effective, we could leave the jaws closed, but this is not the case. The second thing is the instrument should be, I mean, we have to check the efficacy of the plasma machine itself. Some plasma machines are not well standardized, and that's why the instruments coming out of these are not sterile as they are supposed to. So it's very important to calibrate, to standardize, and I think some of the hospitals in Egypt are doing this in every single time, like the French hospital, for example. So they have to standardize each time that it is working properly, but it does not penetrate like the autoclave. This is to answer your question. No.
But to be clear, Dr. Ashraf, we should differentiate between the method of sterilization and method of disinfection, because we have a young doctor, and the plasma is one of the methods of the sterilization, contrary to the Sidex, which is disinfectant.
High-level disinfection, yes.
Yes.
The problem with the Sidex again is immersion. Immersion in fluids is very dangerous for the moving parts of the instrument. I mean, I'm sorry, but the Sidex is the usual method of sterilization in Egyptian hospitals because it's much cheaper than plasma, and the plasma is not available everywhere. So immersion in the instrument and in Sidex for some time, minimum 30 minutes as supposed to be, affects the performance, and it ruins the instruments much more fast than the plasma. As Dr. Fahim said, it affects the plastic, but it lives a long time rather than the Sidex. So the Sidex is cheaper in the very beginning, but on the long run, it ruins the instruments much faster than the plasma.
There's something more that about this Sidex, that this Sidex, if not washed very properly, and if a drop of Sidex dropped inside the peritoneal cavity, then probably the patient will have some sort of peritonism. And I faced it a long time ago. I was working on a colleague, doing a hernia on a colleague, and the scope was not washed properly. And he was my professor, actually. He was not a surgeon, he was an anesthesiologist, but he was the age of my professors. And I did a hernia, a good hernia for him. And in the following 2 or 3 days, the patient was having a sort of peritonism until it resolved by dilution. So this Sidex can be very injurious and can produce some sort of peritonism if it is not washed properly. Washing itself is a process. It's a very difficult thing. They bring some saline. Yes, they wash it with saline.
Yes.
So it's very difficult to clean. It's not enough. It's not good enough, and it should be washed very properly.
Yes.
Especially if it is used for the tubes, because for the insufflation tubes, you can never clean the tube 100%. That's it.
Finally, to summarize this meeting, I want to give the final records about this, and if anyone from my dear professors want to add to what I will say, it's welcome. So first, to ask the government that the insurance will cover the bariatric surgery, and to elevate the standards, trying to use the instruments as a single-use instruments according to the guidelines. This is number one. Number two, we should be so frank with the patient, whether we are reusing the instruments or we use it as a single use. And the patient should know that there is a difference in the cost. We are using most probably these instruments to lower the cost. This is number two. Number three, that the reuse of the instruments in our experience, whether in Egypt or on Saudi Arabia, to somewhat is good, considering some consideration in the sterilization. We should sterilize the instruments by the plasma, and the metal instruments we should be autoclaved. Also, when we reuse the instruments, again we should check the mechanical power of the instruments, it's whether working or not, before re-sterilize it. Also, as Dr. Ashraf mentioned, that the importance of the processing of the instruments, the washing, the sterilization, all these items should be done carefully. Also, before we use the instruments, we should try it, close it, open it. The functions are done before we put it inside the patient. And another tip, we should pre-operative investigation we should do for all patients: the hepatitis C virus antibodies, hepatitis B surface antigen, and the HIV antibodies. And if the patient have positive finding in these 3 items, we shouldn't by any means reuse the instruments, and these instruments should be disposed. So if Dr. Muhammad, Dr. Ashraf, Dr. Fahim, and Dr. Abdurrahman wants to add to this summarization, are welcome.
And you have said almost everything that and the very short summary is that disposable, reusable instruments are preferred, and disposable instruments can be used in some circumstances, and if they are to be reused, cleaning, good sterilization, not Sidex, and for limited times with checking the instruments, as you said, before use. This is a very short summary about what have been said.
And finally, we encourage the young generation still to be using the USA or the European products, and let Chinese products take chance, but after some experience. Okay. So yes. Thank you, Dr. Fahim, Dr. Abdurrahman, Dr. Ashraf, and thank you, Dr. Muhammad. And now we will end this session, and hopefully we will meet again next Thursday in another issue.
Great.